Hello everyone, welcome back. Today I'll be covering regarding a biopsy, a part 2 video. Among my master exam question, I hope this video will help you too. Thank you. Now let's get started. Open biopsy is a gold standard for diagnosing a tumor. However, recent studies suggest comparable results with percutaneous core needle biopsy, CNB. Surgeons need to answer two questions prior to performing a biopsy. Number 1, where is the best part of the lesion to be biopsied? 2, what are the safest routes without contaminating other anatomic structures? The disadvantage of open biopsy: a wound healing problems, infection, tumor cell contamination, and nerve and vessel injuries. For open biopsies, the incision should be as small as possible and longitudinal. Transverse incision is not advisable. To perform an intraosseous biopsy, the window should be circular or oblong and as small as needed to prevent a pathologic fracture. Closing the window by PMMA prevents the tumor cell contamination. Use of a tourniquet without exsanguination helps better visualization and meticulous hemostasis, which prevents spreading of the tumor cells in hematoma. Importantly, it should be deflated before closing the wound. The port of entry of drains, if necessary, must be in line and proximity to the skin incision, because this tract is also contaminated and must be excised with the surgical specimen. Next, what is the correct site? Regardless of the type of biopsy, its placement is critical. For appropriate placement of the biopsy, the surgeon needs to know the probable diagnosis and the extent of the tumor and should establish appropriate plan prior to biopsy. He or she should not be concerned only with obtaining tissue for diagnosis, but should think about definitive operative procedure. Transverse incision in the extremities are contraindicated because the site of incision cannot be excised and blocked with the longitudinally directed segments of bone or musculo-aponeurotic compartments. Therefore, longitudinal incisions are used in the extremity. The major neurovascular structure should be avoided because if they are contaminated during the biopsy, they may have to be sacrificed during the definitive procedure that follows. This figure illustrates the incision for the proximal tibia is anteromedial or anterolateral, a safe distance from the margin of the patellar tendon. Utmost care should be taken to prevent contamination of the patellar tendon. So again, best to violate only one compartment. No joint should be violated, especially the knee. Standard operative approaches in the orthopedic procedure may prove inappropriate for a biopsy. Example, biopsy of the humerus through the deltopectoral interval causes dissemination of tumor cells through the normal neurovascular planes. appropriate to do biopsy through the anterior deltoid as to contain the hematoma, and then resect and block the biopsy contaminated deltoid with the humerus during the definitive procedure. Again, this figure illustrates the correct site for biopsy from the proximal humerus. It should be through the anterior deltoid so that the hematoma can be contained by the muscle. The standard deltopectoral site would allow tracking of hematoma and tumor cells along the loose areolar planes. So what is incisional biopsy? We take a part of the tumor cells and send for pathology. The indication usually in hazardous location of the lesion. Great suspicion of malignancy. Whenever the lesion is difficult to excise because of its extensive size. In cases where appropriate excisional surgical management requires hospitalization or complicated wound management. The technique of incisional biopsy. Representative area are biopsied in a wedge fashion. Margins should extend into normal tissue on the deep surface. Necrotic tissue should be avoided. The sample should be taken from the edge of the lesion to include surrounding normal tissue. It should be deep enough to include underlying changes of the surface lesion. This figure illustrates how to do a wedge biopsy or incisional biopsy. It is done in a chronic ulcer or wound. In a wedge pattern, partial lesion is removed. It should include the epidermis, the dermis, and subcutaneous tissue. The technique for incisional biopsy. A narrow, deep specimen is better than a broad, shallow one. The disadvantages. Spillage of tumor cells due to local tumor spread in the hematoma and wound complication. Wound complication and inappropriate situation of the incision may compromise the local treatment. Open surgical biopsy may enlarge the extent of the sarcoma resection and compromise function. If the diagnosis is benign, then there are no functional sacrifices. Next question, what is the difference in doing a soft tissue tumor versus a bone tumor? In soft tissue sarcomas, the periphery of the tumor is the growing part and usually represents the true underlying malignancy. The center of the tumor may be hemorrhagic or necrotic. Thus, taking biopsy from this part may distract from the correct diagnosis. Extraosseous part of a bone sarcoma is representative as bony component of the tumor. Violating the bone and weakening the cortex may predispose it to pathologic fracture. So, biopsy of an extraosseous part is sufficient for the diagnosis if present. Another question. Advantage and disadvantage of true cut biopsy versus open biopsy. For true cut biopsy, the advantage, it can be done as outpatient procedure, less tissue trauma, less blood loss, less risk of complications such as hematoma, infection, and pathologic fracture. helpful in difficult areas such as the spine, the pelvis, and the hip. The disadvantage of true cut biopsy: specimen is not representative enough of the pathology or inadequate specimen obtained. For open biopsy, the advantage: specimen obtained is generally adequate in quantity and less challenging to the skills of the pathologist. The matrix, cells, as well as the architecture of cells can be studied, and if necessary, special tests can be done. The error in diagnosis is therefore less. The disadvantage of open biopsy: need to be done inpatient, scheduled as operative procedure, general anesthesia is required. Open biopsy is a traumatic procedure. Greater tissue trauma, more blood loss, and higher risk of complication, example, hematoma, infection, and pathologic fracture. If a tourniquet is used, risk of tumor spillage after tourniquet release is higher. That will lead to contamination of large areas of the limb. It is a less forgiving procedure, and correct technique is important. Yay! We have reached to the end of this video. I hope it helps. See you in the next one. Take care and bye.